as Mississippi Hospital Association President Richard Robertson made the rounds, visiting with doctors and hospital administrators in Northeast Mississippi. Medicaid reform was the top issue.
We're very appreciative for the support that was provided by the House and the Senate leadership, and in the most productive conversation we've had to date on Medicaid expansion and looking at real solutions that are tenable for low-income working Mississippians.
Robertson was named president of MHA this summer. He served as MHA's vice president of policy and state advocacy from 2015 to 2023, coordinating the association's government relations and health policy strategies. And with former President Donald Trump elected to a second term, Robertson says there could be a path to modernize Medicaid that was attempted during President Trump's first term.
In January of 2020, the Trump administration offered their version of a plan to cover low-income working Americans, and that's called the Healthy Adult Opportunity Waiver. I think that's something that we can look at now that we know that President Trump will be coming back into office in January of 2025.
Robertson also says reform is needed when it comes to Certificate of Need laws. That legislation was established at the federal level and requires new medical facilities to obtain government permission before opening. Robertson says that limits growth, access, and affordability.
In Mississippi hospitals, about 65 to 70% of the payments come from government payers. So it's really important that someone's looking at the cost of health care services. It's also really important for folks to know that Mississippi hospitals are the lowest cost hospitals in the country. So we do a great job controlling those costs.
And keeping patient data safe from hackers is another top priority for the new MHA president.
Cybersecurity is a huge challenge across a lot of industries. Hospitals and healthcare systems, unfortunately, have been major targets, not just of your hacker sitting in a basement, but state-sponsored hacking and cyber threats from countries that are not aligned with the United States' interest. And so blocking those threats is a big thing that we're going to be working on as well. We've already had conversations with some partners around the state with cybersecurity platforms that we can offer our member hospitals.
Robertson says MHA will also be working with community colleges and four-year colleges and universities to find ways to not only train future healthcare workers, but to also help them find careers in Mississippi. Telling your story in Tupelo, Allie Martin, WCBI News.